Well, good morning, everybody. You know Deloitte & Touche as your favorite accounting, tax, and consulting firm. My day job is helping folks kind of look out the front window and resolve complicated things like litigation, get transactions closed. And for the last several years, our clients have been struggling more and more so with putting together budgets where their health care costs for their employees are just growing at kind of twice of revenue growth or twice inflation. And so it's become a bigger piece of our attention. And a little over a year ago, I tried to get the center to come down and speak to a group of my clients in an environment like this. And no good deed goes unpunished. You put something together and you end up speaking at it. So for the last year, I've been doing these types of presentations to try to help business folks understand exactly how this is going to impact you. And to a certain extent, I'm excited we now have a bill to talk about as opposed to speculating what the bill will look like. So just to kind of put this in perspective a little bit, we actually now have a bill, and to quote our vice president, it's a big deal. It's a little early in the morning to only be serious about this. It is a big deal. And to put it in perspective, how much is $1 trillion? Well, not print out, because we're not going to do that, but if you actually stacked up $1 trillion side to side, it would wrap around the equator of the earth almost 3 times. So we're talking about a lot of money. And so I'm going to attempt in the next few minutes to tell you where those dollars are going to go and where those dollars are going to come from. So we're talking about over 1,000 pages worth of bill, and there's a lot of things that haven't been addressed. So there's no doubt any of you can pull up the document, go to page 75 and say, what's this mean? And I can't answer this. So we're going to stay at a high level. And we have additional support and resources. If you have follow-up questions for me, please let me know. We'll get you additional information. As Bill mentioned, we have the Deloitte Center for Health Solutions, which is in Washington, D.C. Paul Keckley, who's the former vice chancellor at Vanderbilt, runs that for us. And we have lots of additional information we can get to you as you're trying to manage your businesses in this environment. All right, so let's go a little further into it. So now we've got our $1 trillion. So what's the bill supposed to accomplish? Well, generally speaking, the president set out in his health reform package to do 3 things, and that is to cover more Americans. So there's 46 million Americans, including kind of the young invincibles, the 22s, 25-year-olds that work for you who don't take health care, the illegal immigrants and illegal aliens that don't have health care, and other working folks that can't afford premiums, and folks who work for organizations that don't offer health care. So it's about 46 million folks, and this bill attempts to get 32 million of them covered. That's significant. Order of magnitude, that's another 10% of the population covered with health insurance. Now that poses some challenges of we didn't overnight create 10% more doctors, nurses, and hospital beds, right? So there are some challenges, but this is the law of the land. In general, what this means is the people that are going to get picked up through the government programs this is going to fund. We have really 2 main programs. Medicare, we care for the elderly. Medicaid, we aid the poor, and we aid the young. And so the big increases in folks who will be covered in this population are children, parents of poor children, and other working professionals that are just below the income level. So a lot of new folks coming into the system, and about $400 billion of it is to put new folks into the Medicaid program and help with the children's health products. The next big slice, which is a little bit bigger, $466 billion, is for subsidies to fund insurance for individuals and families up to the 400% of the federal poverty level. So we're creating opportunities for folks at higher income levels, but still maybe diminished versus their ability to afford traditional products to buy in. And then there's $40 billion for small employer tax cuts. So that's kind of where the first $940 billion is that we're going to spend. Where are the dollars going to come from? So there's a laundry list here on the bottom of this page of where dollars will come from, and a couple of those to hit is that there's roughly $60 billion in penalties to be paid by folks who opt to not take health insurance. So you're going to hear a lot about this in terms of the individual mandate. So the law of the land is that you'll now need to have insurance, health insurance, just like if you're a driver in Texas, you need car insurance. And so if you opt out, you'll be paying a tax, or paying a penalty for it. And there's been some good discussion in the last day or two about who's going to be collecting that, how many IRS agents will have to be hired to verify that we're actually purchasing our health insurance. The next piece is $196 billion in reduced Medicare scheduled payments. So how many of you run a medical group or a hospital? Right? So those of you who are in that box, those are scheduled cuts to you. How that will play out, we think will probably be kind of split into two ways. If you run a business that looks like an acute care hospital, possibly with physician ownership, a nice set of services, maybe kind of cherry-picked, probably going to hit you a little harder than if you run an academic medical center, taking care of kind of the entire suite of services. We think there'll be a product mix factor in there, there'll be a severity factor, and then kind of a community factor in terms of the types of folks that you're serving. And then there's going to be some additional cuts. The next pieces are smaller. Let me drop down to the to $103 billion in Medicare payroll tax increases. So for folks making over $200,000 or couples over $250,000, another approximate 4% payroll tax for Medicare. So a whole bunch of other little taxes that will be coming through. In particular, taxes on medical devices and drugs. Let's see. Now that was then we had to get the Senate fixes to the bills that were passed, and so the compromise package added another $60 billion to the plan's overall cost. So you might have heard that reconciliation is supposed to be budget neutral, but this is what happens when the parliamentarian says, I'm the parliamentarian. It doesn't have to be budget neutral. So you can have additional costs that come through in the reconciliation process. So in here, the particularly interesting changes to those of you who are employers is the first line. That's why I put it there. This set of bills also has an employer mandate. So if you have over 50 employees, so how many of you work for an organization with more than 50 employees? Y'all haven't raised your hands yet, so I'm going to actually make you move. All right. So if you have over 50 employees, the penalty before the fix was $750 per employee if you didn't offer health benefits. It's now $2,000. It's pretty significant. So if you were providing one of your employees an individual health insurance product that was costing $5,000 to $8,000 and maybe a family product that was up to $15,000, if you take that away and you still pay $2,000, it's a pretty good incentive to keep you in the program. All right, so this is significant. Richard, this is going to be great for your business. The next piece down is closing the Medicare prescription donut hole. And so this is a Part D product that senior citizens have available where the first $2,500 worth of pharmaceuticals are paid for, and there's a gap in the next piece. There's a closing there. Cadillac tax threshold is going to be raised. That's obviously part of the lobbying to get the votes and working with unions. And then, again, the 3.8% Medicare payroll tax. And then we took back the Cornhusker compromise in the final package where the federal government will instead help every state by picking up the increased cost of Medicaid in the short run. And then they did lower the fine for individuals who don't purchase coverage. It's a nominal amount from $750 to $695. So small tweak there. The biggest piece in the Senate fixes is the increase from $750 to $2,000 per person to opt out at the employer level. And the way that really works is if you have 50 employees and you opt out of the program, you don't pay for the first 30 employees. So you start with employee 31. So if you're a large organization with 5,000 folks, it kind of averages out to about $2,000 per person, but you do get the first 30 for free if you opt out.